Welcome to Medical Minutes, brought to you by Passavant Hospital. I am Dr. Peter Russotto, your host and moderator. Today in the booth, I have with me Karen Sibert, a registered dietitian. We will be discussing Passavant Hospital's outpatient dietitian department and its many programs. Many people are unaware of all the information and help that this department can provide concerning their nutrition and dietary restrictions. Sometimes patients are overwhelmed when they are put on a dietary restriction and do not know where to turn. Today, Karen and I hope to give you some information and where to turn for your answers. First of all, Karen, thanks for being here.
Thanks you so much for having me. It's great to be here.
We're going to start off with the first question is, how does someone get an appointment with your office or yourself?
Well, the best way to do it is to go through the healthcare provider, which could be the physician or nurse practitioner, physician assistant. And sometimes the doctor approaches it, but sometimes the patient will approach it. So I've had people call me up and say, I'd like to come get an appointment with you. And I say, please just call your doctor and get a referral. And that helps with insurance coverage.
So basically, if it is a referral from the primary care physician or anybody, it is usually covered by insurances?
Sometimes yes and sometimes no. Currently, type 2 diabetes, type 1 diabetes is covered, and end-stage renal disease. And that's covered by most insurances. Whereas some people who come in for obesity or for high cholesterol, they really need to check with their insurance plan. But the way we have things set up is we want people to get the information so we can help whoever needs to be helped regardless of their ability to pay.
So in a nutshell, you'll work with anybody just about.
Exactly.
But is there a difference for a Medicare versus primary, a private insurance?
Sometimes Medicare will really just cover the diabetes and the kidney disease. Some insurances will cover more. There are certain insurances that if 3 different people had one type of insurance, they may all have different types of coverage. Like some people, it might cover obesity. Some people, it might cover high cholesterol. For many years, nothing was really covered to see the dietitian. And I think insurance got smart and healthcare hopefully got a little bit smarter, saying, wow, if we teach people how to eat, we can really cut back on the complications that can happen when the diabetes is left out of control.
So like a little money spent at the beginning is a lot of money saved at the end.
Oh, preventative care, of course.
And you want it all by appointments, correct?
Yes, we have everything by appointments. We do have some classes at the hospital. A Learn More About Diabetes class that meets once a month that's free and open to the public. That's the 3rd Wednesday of every month. And that's a little bit different because it's general guidelines that's being given out, not necessarily sitting down and figuring out what that specific person needs.
So where exactly is the dietitian's office located at Passavant?
Well, we are on the ground floor, and technically it's the east wing of the hospital, but since the hospital has had the addition with the physician's offices really to the east end of the campus, we usually have people go in the main entrance, which is the entrance by the gift shop and the meeting rooms, and then they come down the hallway in the educational services area, and now pastoral care services is in that same area.
How long would an appointment take on the average?
The appointment will usually take an hour, sometimes a little bit less, but it really takes time to figure out what someone eats. You don't just come in and say, okay, you need to be on this sort of diet. Here's your paper. There you go. Because if I give you information about, say, a low cholesterol diet and you don't eat half of the things that are on the list, but you eat some other things that aren't on the list, that's not really helping you.
So in order to actually contact you, we didn't really go over the numbers. What is the number or extension that a person would contact at the hospital?
To schedule an appointment, we go through the central scheduling department, and sometimes they can even help schedule getting the information from the doctor's office, and their direct number is 217-479-5696, and my extension is 479 5725 or the hospital number and then the extension 5725.
But like you mentioned earlier, you prefer that the patient actually coordinates this with their primary care physician, and I'm sure they have your number on file. So
they do.
Yeah. And what do you cover when you meet with the patient? I know you talked about a little bit about what a journal maybe of what they eat, but what other things do you cover with them?
Well, we usually will get their height and weight and find out, have they gained weight? Have they lost weight? What's their weight history? If they've had diabetes, how long they've had diabetes? Have they met with a dietitian before? Some people have had diabetes for many years, and this might be their first appointment with a dietitian. So they may have just learned what to eat from their aunt or from their grandma or reading something on the internet, and that's not always true. So we find out the height and weight, we get a usual intake, and then I sit down with them and really just figure out what I can do to help them meet their health goals. And usually, again, with someone with diabetes, we want to get their blood sugar numbers in a healthy range. Someone with high cholesterol, we'd want to be able to bring the cholesterol levels down.
So do you get the lab values basically from the patient themselves, or do you coordinate that with the physician's office?
We try to get them from the physician office beforehand. Some of the patients now, with the changes in healthcare, they can access their lab work, so we can get into the lab work before they come in.
And I assume it would be correct to ask the patient what are their other medical conditions, because you want to tailor everything to their whole general health, not just whether it's a diabetic diet or a cholesterol diet, correct?
Exactly. There are sometimes within a household that they may be on a fixed income, and we have to take that in consideration because I get many comments, well, I can't afford to eat a special diet. And really, when I hear that, yes, the more processed food can be less expensive, but making smarter choices with their food budget, we can help with that too.
And you would probably want to know any food allergies or any maybe medication allergies or anything like that, correct?
Right. And that's a good point. That really leads us into, which isn't really a food allergy, but gluten intolerance and celiac disease, where a lot of people are going on a gluten-free diet. And they're just helping them figure out how to look at a label and find what might be hidden sources of their food allergy or gluten.
Do you ever work with somebody to scrutinize a label, such as if they have a peanut allergy?
Yes. Mm-hmm.
I mean, because as we all know, somebody with a peanut allergy could be a life and death situation.
Exactly. And I know the schools have taken into consideration how they approach, are peanuts even in the school? Do you sit at a different table? So that's really changed, I know, since in my job career.
Yeah, I mean, it's for some of these individuals, just if their brother, sister, loved one has had something with peanuts, it could be life-threatening for them.
Mm-hmm.
And how many times does a patient usually come in for a consult? Is it once, twice, or is it just tailored to the individual?
Well, unfortunately, most insurance will only pay for one visit. There are some insurances that will pay for a certain number of visits over a period of time, but usually it's only one visit, which is discouraging. I'd really like to be able to have more than one visit with a patient, but we have to do with what insurance has.
Does a patient ever sometimes maybe, have their consultation with you, and maybe 2 weeks later you might say, give me a call, let me know how you're doing, or if you have any questions?
Oh, definitely. Like every time a patient leaves my office, they'll have my office number so that they can call if they have any questions. Sometimes email works better for patients. I do want to make a point that we do work with interpreters. So if we need a language interpreter, I've worked with those before, whether it's hard of hearing or a different language.
Yeah, so there's a lot of avenues for you to educate that patient, correct?
Exactly.
Who would benefit from seeing a registered dietitian? We touched briefly on some of the medical problems, but can you expand on that?
Well, definitely people with type 2 diabetes, type 1 diabetes, high cholesterol, high blood pressure would benefit. It's not usually one that's covered, so I don't see that as often. But we do know that making even small dietary changes can help control blood pressure. Definitely obesity. We know that the obesity rates in the United States are soaring, and we've really gotten a handle on that. And I think just being able to meet with somebody, and Medicare is setting things up differently so that being able to work with a physician might be easier to get some reimbursement, so we hope to see that area grow. People who aren't really growing the way that they should. So I've worked with young children who aren't really eating the right way, or we're evaluating them to see if their growth has anything to do with their nutritional intake. Or again, older people who, I don't, my spouse died, I don't really know what to do about eating, I've been losing weight. So looking at that.
So sometimes, there's a diagnosis, failure to thrive. I mean, malnutrition, anemias, I'm sure.
Yes.
And you touch with some of the individuals about maybe some protein shakes or additional nutrition and things like that, correct?
Correct. So, and with that, not necessarily just focusing on nutritional shakes, but sometimes giving them different areas of what they can do to get enough nutrition. One of the areas that we've worked together before is in the wound center, and helping patients with poor healing wounds look at their nutrition to see if there's something we can do better with that.
That's a good point. Diet is a factor in a lot of different things, and so is nutrition. And like you said, one of the first things in wound healing, you got to have proper nutrition in order to get that wound to heal. Even post-surgical patients who sometimes are very lethargic, don't want to eat, can benefit from a dietary consultation.
Mm-hmm. And when someone is in the hospital, the dietitian makes every effort to see them while they're in the hospital. But the great thing about an outpatient appointment is the person doesn't have bells going off and buzzers and people coming in and worrying about, when you're going to go home or how you're going to feel when you go home. So we can really focus on the healthy eating aspect.
Do you ever counsel any patients for low sodium diets or people that have congestive heart failure, things like that?
The hospital has a program, the H2H program, and it focuses on people with congestive heart failure. The physician can refer them over into this program, and they work on keeping people who have been in the hospital with a congestive heart failure diagnosis from having to get back into the hospital. So we definitely look at reading labels with that, because sodium plays a huge role in fluid retention, which plays a big role in the congestive heart failure.
We talked a little bit about Medicare, and of course we talked about primary insurances, but just for our listening audience, does Medicaid or Department of Public Aid cover any of your services? Not
usually, but again, when we work through the business office, that's something that we can take care of on an individual basis.
So again, like I said, you will try to provide the services as best you can, no matter what the insurance.
Exactly, because the hospital realizes that giving care now is going to save the taxpayers' money, the patient money, and ultimately the hospital money.
Yeah, and we're there for the community. Great information, Karen. Is there anything that I didn't cover or that you would like the listening audience to know about your services that we got the opportunity now to bring about before them?
Well, I think if you do have a question about what you can do to improve your health, definitely talk to your healthcare provider and see if you qualify for an appointment with the dietitian.
Well, thanks again, Karen, and we'll close this with good health to all.